What is urticaria? Urticaria is a skin condition that is often seen in people as a result of allergies. The main indication of urticaria is the appearance of large, raised, red, itchy eruptions on the surface of the skin. These eruptions are called hives. Hives may develop separately and then merge together. The true test of an urticarial eruption is that if you press in the middle, it will turn white for a second or so due to pressure. Urticaria is an extremely unpredictable condition. People who suffer from this condition are often harassed by the irregular occurrence and relapse of this complaint. Sometimes there is also a swelling in the deeper layer of the skin along with the hives. Some people get swellings of the lips, eyes, hands or feet. This is called angioneurotic edema and is a more severe form of urticaria. What causes urticaria? These itchy eruptions are caused by a variety of reasons. The main reason for their development is allergies to various substances. When the body comes in contact with any substance that causes allergies, a chemical called histamine is released in the body along with other chemicals and hormones. Histamine is mainly what causes the development of hives. The most common allergens are foods. Reactions to food items often occur immediately. Foods like shellfish, milk, eggs, wheat, soya products and nuts cause the majority of urticaria episodes. Certain medications like aspirin, penicillin, sulfonamides, some anticonvulsants and some anti-diabetes drugs. Insect bites, animal dander, especially of cats and dogs. Physical force. Itching or scratching the skin of some people result in itching and development of hives on the skin. This is called dermatographism. Pressure or delayed pressure. In some people, the use of tight clothes or pressure on the skin also results in the development of hives on the skin. This occurs mainly around the waist due to the use of belts. However, this form of urticaria is comparatively rare. Stress. This form of urticaria is actually pretty common. It is seen after any physical or mental stress or any activity that raises the body temperature. Exercise or hot baths can also bring about this form of urticaria. Sometimes the lesions in this form are smaller than the normal hives that are seen. Lowered immunity. Sometimes autoimmune illnesses like lupus or infections like mononucleosis can bring about the development of hives. Extremes of temperature. Exposure of the skin to high levels of heat or cold can cause development of hives on the skin. Sunlight. In rare cases, exposure to strong sunlight can set off an allergic reaction and cause the formation of hives on the skin. Water. This is one of the rarest conditions, but several cases have been recently reported in the media. Exposure to water in any form like baths or even sweating cause the development of hives on the skin. What are the complications of urticaria? Sometimes urticaria can progress further and develop into angioneurotic edema. Sometimes this can cause swelling of the throat and nasal passages, which can lead to serious complications. Call your doctor immediately if you experience any of the following symptoms during or after an episode of urticaria: fainting, shortness of breath, tightness in your throat, tongue or face swelling, wheezing. How can your doctor diagnose urticaria? The main way of diagnosing urticaria is by the appearance of the eruption. Your doctor will be able to look at the eruptions and understand whether they are urticaria or not. Sometimes a skin biopsy may be needed to diagnose urticaria. What are the treatments for urticaria? Urticaria is often a very difficult condition to treat as the symptoms and their triggers vary widely. One of the main methods of reducing urticarial outbreaks is to avoid the triggering factors that cause the eruptions. However, this can prove to be very difficult since many people are allergic to more than one thing. Also, many cases of urticaria occur without any obvious triggering factor, which makes it even more difficult to understand what will set them off. Avoid hot baths and tight-fitting clothes just after an attack of hives. This will trigger another episode. There are some medications that reduce the production of histamine in the body. They are called antihistamines and are often prescribed for many allergic conditions like urticaria. However, antihistamines often have a side effect of drowsiness, and that can make them unpleasant to use. There are several other medications that are prescribed for reducing allergic reactions. These include antidepressant medicines. In some severe cases, steroids are also prescribed. However, the side effects of these medicines are more than their benefits, and hence they are not very commonly used. Topical ointments like camphor-based ointments are often prescribed for urticaria. Sometimes ointments are also prescribed which numb the nerve endings and prevent the itching associated with hives. The good news is that most cases of urticaria are not associated with long-term or severe complications. It may be an irritant complaint, but it will not harm you in any way.